Now we're going to demonstrate how to remove the platelet-rich plasma from the whole blood sample. After centrifugation is complete, we can see the separation of the blood. To extract the platelet-rich plasma, which is the component above the gel separator layer, we're going to first use one of the Meso needles from the supplied PRP kit to vent the tube. We vent the tube because these are vacuum tubes and they are under pressure. So we want to release that pressure so that as we draw the PRP out, it does not try to suck it back into the vacuum tube. Next, we're going to take our 10cc syringe that's supplied in the kit, along with the 18-gauge spinal needle, also supplied in the kit, to extract the PRP from the tube. We're going to attach the 18-gauge spinal needle to the 10cc syringe like you see here. Take off the protective sheath. Now we've got our PRP sample here. The goal is to get the collection needle down to the furthest point above the gel separator layer. So we're going to enter this in the middle of the tube. Get the needle right down next to the gel separator layer there. And we're going to draw about half of the PRP. Now we want to resuspend the platelets that are located in the bottom of this tube. So we're going to swirl the tube gently to resuspend those platelets and continue drawing that PRP. Repeat this step for the other tube. Now, for the second tube, I'm going to demonstrate a different way to resuspend the platelets. There's not a scientific consensus on whether swirling or shaking or how to resuspend the platelets is correct. The scientific data seems to point towards swirling at this point in time, but I'm also going to demonstrate the gentle inversion mechanism. So after we've drawn half the PRP, we're going to invert the tube gently twice to resuspend the remaining platelets. You'll see that the sample is slightly more cloudy than it was previously due to the resuspension of the platelets. Draw out that PRP. Now we have our harvested platelet-rich plasma. We're going to resheath and remove the 18-gauge needle and attach the stopcock. The stopcock is going to allow us to draw this PRP down into other size syringes for whatever procedure you'll be doing. In the majority of orthopedic procedures where a higher volume of PRP is needed, you'll use the supplied 5cc syringe to draw this out for injections such as interarticular, fracture repair, wound healing, and things of that nature. Utilizing the stopcock to draw that PRP out into the syringe that will be used for the medical procedure.